My name is Vera Rigolin, and I am the topic coordinator for the Multimodality Imaging Pathway at ACC.21. I'm professor of medicine at Northwestern University Feinberg School of Medicine and the medical director for the echocardiography laboratory at Northwestern Memorial Hospital. The main goal of the Multimodality Imaging Pathway at ACC.21 is to give you a real-life experience of how we use imaging in day-to-day practice. And that's why we actually focused on the multimodality aspect, because that's how we take care of patients. We take care of patients based on disease states rather than on specific imaging modalities. So we hope to give you practical and informative information so that you can take care of your patients the best way possible. We have a lot of really exciting sessions in the imaging pathway, and I'd like just to highlight a few of those. First, we have several that evaluate special populations, and that includes, of course, individuals with COVID-19, but others that look at the cardio-oncology population, another that looks at athletes, and then another really interesting session that looks at the use of multimodality imaging in the role of prevention. And we have another very interesting session that looks at imaging registries and how those will transform healthcare in the future. Other scintillating topics include the role of multimodality imaging for those with patients with suspected microvascular disease, and another one with those with cardiomyopathies. And we also have, of course, our global health session. And that looks at the impact of point-of-care echo and how that technology is transforming healthcare around the world. And we have some sessions that are particularly interesting for those individuals who are still in cardiovascular training, the FITs, and individuals who are in their early stages of career. And those sessions include how can I tell if this aortic valve replacement is functioning normally? There has been a huge increase in the treatment of aortic stenosis with an increase in the number of TAVIs and surgical aortic valve replacement surgeries. So it is really, really important for all of us to clearly understand how to image these prostheses and how to tell if they're functioning normally. So that's a great session to learn those skills. There's also a session called Imaging Decision Making in Everyday Clinical Practice. And this provides very practical information on how to use imaging in the types of clinical scenarios that we encounter in our day-to-day practice. So that one should not be missed. And finally, we have a really great session looking into the future. And that is looking at the role of artificial intelligence in daily practice. We know that artificial intelligence is really impacting all areas of medicine, and in particular cardiovascular imaging. So that is another session that should not be missed. Refocus, reconnect, and reimagine at ACC.21.